Hi, I'm Dr. Steve Scionti, the director of the Scionti Prostate Center in Boston. Today I want to talk to you a little bit about the concept of focal therapy for prostate cancer. We have a real problem today in the treatment of prostate cancer. We're accused as urologists many times of overtreating this disease. In reality, there are men who have very small amounts of disease and very early stage disease. And if the only option those men have is radical surgery, in many cases we've overtreated these gentlemen. On the other hand, sometimes there is very significant disease that's life-threatening, and that requires the most aggressive forms of therapy that we have. The real key to the whole thing, I think, is getting accurate diagnostics. In other words, a better ability to truly understand the nature of a man's prostate cancer in terms of the size of the cancer, the location of the cancer, and quite importantly, the aggressiveness or the biologic nature of the cancer. Today, functional MRI studies, or what's known as multi-parametric MRI studies, give us a great ability to see the tumor in 3 dimensions, and that combined with biopsy techniques gives us a better ability to understand the true nature and extent of a man's tumor within the prostate. It's been estimated that up to 40% of men have a cancer that's truly confined to one region or one side of the prostate. And if we can identify those men, we have the ability to use what's called focal treatment. Much as the paradigm with women's breast cancer, that is, the lumpectomy, took hold 20 years ago, that same concept really, I think, is valid in prostate cancer. That is, if we can find a tumor early enough that's well localized to a region of the prostate, and we've done the appropriate diagnostic studies to understand that that cancer truly is in that area, then we have a whole variety of tools today that didn't exist years ago in which we can focally or regionally treat that tumor. The real reason to do this is to find a better balance between treatment and side effects. You see, it's important to be able to preserve quality of life. It's important to be able to preserve erectile sexual function. It's important to prevent urinary incontinence. Not every man requires the full-bore treatment. So, as a urologist who really specializes in ablative therapy and has a strong interest in advanced diagnostics, I tell my patients that the most important thing we can do is to truly understand the disease and really look for men who have the ability to treat a prostate cancer in a regional and focal manner. Now, we have a lot of tools today to do that. The standard tool that we've been using now for almost 20 years is focal cryotherapy. Focal cryotherapy is not new. It's been around. I've been doing it now for over a decade, and it gives us the ability in a hospitalized setting to place cryotherapy probes or freezing probes into the prostate and freeze a region of the prostate. The next real technology, though, that's on the horizon and soon to be FDA approved, I believe, is focal high-intensity focused ultrasound, or focal HIFU. That gives us tremendous precision with the ability to treat a region of the prostate and gives us real feedback information on whether or not we've had a tissue-killing effect. Perhaps one of the most elegant techniques today is MRI-guided focal laser ablation. This technology allows us to use MRI guidance to identify a lesion and use very sophisticated software to measure the temperature changes that are occurring as we put laser energy into the tumor. This really represents a quantum leap in technology today. And I believe that the combination of cryotherapy, high-intensity focused ultrasound, and laser therapy will allow us to cover the whole range of focal disease. There are certain patients in which we'll prefer one technology over the other. But at our center, we feel that it's important to have all those tools in our toolkit and really be able to offer personalized care, be able to personalize the treatment based on the true nature of a man's cancer and based on a man's preferences and wishes. Today this is a quantum change, a quantum leap, and it's a real step forward in terms of how we balance treatment and side effects. I'd invite you to look at our different websites. Go to www.drscionti.com and look at some of these different modalities that we're using today for advanced diagnostics and for focal therapy.